So today we're going to be accessing our patient over here, and we're in the BR hospital room. So we're going to be walking up over here to the chart we got for him, and his name's Robert Williams, and he's a 55-year-old male, and he's listed in the hospital because he's been having some problems with his COPD with acute exasperation, which is chronic obstructive pulmonary disease, and the acute exasperation is like a chronic bronchitis. So he's been having mucus and fluids in the lungs. So we're going to try to bring that up and have him cough that out. And then along with that, he's been having shortness of breath with running and doing exercise. So we're going to cure that as well, and we're going to try to treat him. So, and then right down here, we have length of stay, which is 18 hours. And then we got all of his vital signs and his last problems. And then over here you got the medication that he's currently taking or has used to be taking. So, hey Robert, how are you doing today?
I'm doing all right. Thank you for asking.
What'd you do over the weekend?
Spent time with family and watched some TV.
Okay. Is it alright if I treat you today?
Yes, that's fine.
Alright. So then we're going to continue with our treatment after getting the clear from the patient to treat him. So over here you got different hand motions you can do when you're treating the patient. So the first one would be grabbing, so closing a fist, and we're going to reach over to the stethoscope, and we're going to be listening to lungs and the hearts and seeing if everything's in check. So first we're going to be doing is taking off his clothes so it's easier to get to the skin so we can get a proper hearing of the lungs and the heart. And then while we do this, we're just going to have quick breaths through the mouth and out the mouth as we're going. So right here, we're listening to the lungs and the apical / the apex region, which is just above the chest. And now we're listening to his heart, the aortic area. And now we got the pulmonic area, which is his heart. And we've got the Erb's point. And we've got the tricuspid area just below that. Then we got the mitral area. And his heart seems all in check and it seems good. So we're going to move down to the brachial section of the lungs. Just going to put the stethoscope down. And it seems like he's been having some mucus problems up here in his left apical apex section of the lungs. So we're going to be accessing that today. And one of the ways we can be doing that is called percussion. So with these, you're going to be doing two kind of cupped hands. And pretty much we're going to place them over that area where we were doing the listening to the lungs, and we're just going to do like slight pounding on the chest, trying to get that mucus cleared up so he can cough it out and his lung airways can be kind of more clear so he can actually breathe a little more clear. And then another way we can help him is through a breathing technique, and this is called diaphragmatic breathing. So this one with the two fingers, we can place it just in the middle of his chest and down a little. And what we're putting pressure on right there is called a diaphragm, and that helps you breathe. It's the main muscle. And we're trying to eliminate the accessory muscles, such as your chest, your back, and you got your shoulders when you breathe in. So we're trying to eliminate that, and we're trying to get more strength in that diaphragm. So then as I'm doing this, I'm going to have him breathe in and out. And then he's just trying to make these fingers rise. And then back down, he's really trying to focus on using just that muscle to breathe. And then after that, we're going to go put his clothes back on. And as you look at the vital signs, everything seems to be in check. He has a little hypertension, which was a problem that was listed already, which is just a high blood pressure. And then his provider, which is physician Joe Bell, he's going to be coming in after me after I get finished with the treatment, as I am doing right now. How are you feeling today after the treatment?
Feeling a bit tired, but overall, not too bad. Thank you for asking.
Then after you ask him about the patient or how the treatment went, kind of getting his thoughts and how tired he is, we're going to go from there, and we're going to have the physician come in, and he's going to finish it off. And the next treatment section, we'll be checking on him in about 3 to 4 hours prior to this treatment, and then physician's going to come in and take over.